Depression and anxiety don't often exist in isolation. In fact, most people who struggle with their mental health during the perinatal period will also experience other mental or physical health concerns. This is important to consider when creating treatment plans for your patients. So let's go through a few of the most common comorbidities you may encounter. 1. Obsessive Compulsive Disorder, also known as OCD. People with OCD experience intrusive thoughts every single day. And parents who face this reality often struggle to talk about it because their thoughts may be dark, violent, or sexual in nature, and they may be worried about having their baby taken away. One of the ways you can encourage your patients to open up is by reassuring them that just because you have a thought doesn't mean you'll act on it. Thoughts don't equal actions, and OCD often responds well to both therapy and medication. Post-traumatic stress disorder, also known as PTSD. PTSD is a mood disorder that often develops in reaction to severe mental or emotional distress. Survivors of assault and women who undergo difficult pregnancies or births are at a high risk of experiencing PTSD. But partners who witness difficult births are also susceptible. Up to 34% of births are traumatic in one way or another. So it's important to consider not only your patient's self-reported feelings, but the reality of what they have been through as well. 3. Bipolar Disorder. Research shows as many as 1 in 5 people who screen positive for perinatal depression may also have bipolar disorder. While some of your patients may experience the disorder for the first time during pregnancy, it can also be a relapse of an existing condition. Bipolar disorder is a serious illness associated with increased risk of psychosis and infanticide. So screening is vital to help keep your patients and their families safe. It's also important to rule out this disorder prior to prescribing antidepressants, as many common drugs can actually increase the risk of mania or psychosis in those with bipolar disorder. These are just 3 of the most common comorbid conditions to look out for, but other comorbidities may also be present, including intimate partner violence and substance use disorders. For more information on how to screen for these concerns, check out the Mood Disorder Questionnaire in the toolkit. And remember, pregnancy is just one part of your patient's life. The more you know about them, the more likely you are to catch red flags and ensure they receive the care they need.